The Newlands Youth HIV Prevention Project is an initiative that has been funded by the Charlize Theron Africa Outreach Project and is implemented by Small Projects Foundation, an NGO located in East London, South Africa. We have interacted with 137 learners located in 8 schools. The program was eagerly welcomed at all schools, with educators all singing the same tune of how the program is a crucial necessity for the learners and schools, that its sustainability is very much imperative. There is evident excitement and hunger for the program from the teachers and learners. Life orientation teachers were particularly pleased because they feel that the previous LO lessons do not provide the education required to tackle these issues sufficiently. So the Bright Futures program will play a necessary role in closing the gaps, and will do so in a way that is exciting and comfortable for the learners, because Small Projects Foundation will be providing young people to work with the learners. The schools felt that it is very important that young people have platforms such as Jam clubs and learner dialogues to address issues that affect them. The program has provided an opportunity for learners to share their future plans, fears and challenges with their parents. 328 orphans and vulnerable children have been identified. Home visits have been conducted to the homes of the most needy children, where the primary caregivers of the children have been assisted to access clinic services. The registration for those who do not have birth certificates will be conducted on the 22nd of August 2015. A place KABP study has been conducted, which has reached over 700 community members from the ages of 15 years. The statistics from 2 clinics show that there has been an increase in number of people, especially youth, who go to the clinics for STI and HIV testing, and also to access sexual reproductive health services. The number of children under the age of 5 years who have tested for HIV has increased from 0 in January 2015 to 30 by July 2015. This is an indication that more women are becoming aware of early infant diagnosis. Of the 30 children who have been tested in 2015, none tested positive for HIV. Out of the 29 children who were born to HIV-positive women, only 1 child tested positive at 6 weeks of testing. This shows good progress in preventing mother-to-child transmission of HIV. The project has been highly appreciated by the communities of Newlands. It has provided people, both young and old, with a platform to talk about health challenges facing their communities. This has enabled SPF to hold discussions with clinic managers with the aim of improving healthcare services.
The problems that we were having before this project came, we were having difficulty tracing our clients who are on medication, and they are living in far-off places like Daniel. Some places are far away from our catchment area, so we managed to assist that our clients can come for medication and be traced with the assistance of the foot soldiers from SPF. And we also managed to have a youth-friendly service in our clinics so that more people can come for family planning, testing for HIV, as well as assist in the program of re-engineering that is doing door-to-door visits, so that we can identify clients who cannot come to the clinic so that they can be able to be assisted.
The community members have reported that there is a change in the level of service provided by the 3 clinics, especially to children and mothers.
The SPF project has helped our community, firstly by letting our youth access knowledge health-wise, as it is the program of the donor to help the poor.
The project follows a holistic approach with regards to fighting new HIV infections among children, youth, and women. The project targets individuals, families, schools, clinics, and shebeens. Working with the community leaders, SPF recruited 30 community members who have been trained to become community healthcare workers. These 30 community members have received extensive training in HIV literacy, TB, prevention of mother-to-child transmission of HIV, sexual and reproductive health care, and adolescent and youth-friendly clinic services.
Ndisebenza no SPF, Small Project Foundation. Ndisebenza as a community healthcare worker. Ndisebenza ngabantu ekuhlaleni ungena door to door. Ndicebisa abantu ukutya iipilisi zabo, abantu abalibalayo utya iipilisi ngexesha elirayithi. Ndingene ezishibhini ndithethe ngotywala obuyingozi nakubantu abakhulelweyo. Ekliniki educator about HIV/AIDS, TB, STI, PMDCT. Kumnandi usebenza no SPF kakhulu. Indincede kakhulu loo nto kuba nditsho ndakwazi nami nothetha nabantu.
Innovative components of the project have been community mobilization, where community members took part in parent-child dialogues and community dialogues, identifying health and social challenges facing their respective communities, and also developing intervention strategies for a healthier community. A second component is the Bright Futures program, which encompasses learner dialogues, parent-daughter communication sessions, and 6 protecting future lessons that deal with puberty, preventing teenage pregnancy and HIV/AIDS, and also sexual and reproductive health rights. These centers offer youth a private and confidential testing place where they can be counseled and educated to prevent teenage pregnancy, STI, and HIV infections. Community mapping of orphans and vulnerable children has been conducted in all Newlands villages.
It improved the life of the youth and children in this community a lot, because at first the youth was not aware of the HIV. All they were aware of was the stigma, and now after the campaign we made education about the HIV and all the infections that are contagious, and then after they heard about them, their lives changed a lot.